So why do some facelifts look natural and others look fake? We've seen it in celebrities, social media surgeons. We've seen the good, the bad, and the viral. But what really makes the difference? And how can you understand how you can get the best results when you're actually ready? I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon, and I'm also the founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. So in today's video, I'm gonna speak to exactly what that means, looking as young as you feel. Today, we're gonna understand facelifts in a technical way from a surgeon's perspective. You're going to recognize good facelift techniques from great ones, reasons why some facelifts fail, how I've personally crafted my approach over the years to give the best, most consistent and durable results possible. And why are we gonna do all this? Well, simply so you can make good decisions for yourself for your anti-aging journey. All right, folks, let's begin. To give you some background, I've literally done thousands of these procedures and truly hundreds of them per year. And I've been doing this for 20 plus years. What do I see from all of that experience? The underlying reason why most people desire to have a facelift is because there's a misalignment between the way they look and the way they feel. The patients who come to me for these procedures, they say, you know, when I look older, I act older, and I begin to lose that spark. They begin to pull away from so many of the activities that young people do, and the sense of self begins to actually diminish. So there's a lot of contributing factors that are psychological that are related to the appearance. This is not just about tightening up jaw lines and tightening up necks. It's about affecting the entire person. In my strong opinion, there's literally nothing wrong with wanting to look like the picture that you have of yourself in your mind's eye. We're living healthier lives, longer lives, and as a result, we want to continue having an appearance that matches that. And that's a very different place than simply, assuming that it's pure vanity. I've actually never really met a single patient who's undergone a surgical procedure strictly for vanity. If you feel this way, or if you've ever felt like this, or this is resonating with you, please feel free to leave a comment below so others can recognize the fact that there's a community here and we're all on the same page. And if you don't agree with this perspective, then share that as well. It's completely fine, but it's opportunities for us to have discourse and conversation about this. But really understanding facelifts from a psychological, emotional point of view is very important for everything that's about to follow that I'm going to explain about what makes not just a good facelift, a great facelift, but actually the best facelift. So without further ado, let's start with the foundation. So the first segment, we're gonna talk about the different type of facelift techniques. But before we do, there's something I wanna set up in your mind. So as we delve into this, you'll have a good foundation. Aging is about shape change. The face, when it's younger, has a heart shape to it. You can also think of it as an upside down triangle where the top is fuller, the bottom is V-shaped and more narrow. During the aging process, which really begins for most people in the late 40s and early 50s, somewhere around where perimenopause and menopause starts happening, there is a sudden shift. There's an elongation that occurs at the fascia of the face level that starts to transform this heart shape to more of a rectangle. Rectangle being the aging shape where things get long and heavy down towards the bottom and more square. The fundamental approach and rationale for any type of facial rejuvenation procedure should be to restore that heart-shaped appearance, that shape back to its youthful look. Anything that doesn't achieve that is faulty in terms of its foundational principle. All the different techniques that I'm about to share, if they fail to give you that heart shape back again, they have failed to make you look like a younger version of you. And as a result, the technique is inferior to any technique that can create that youthful appearance or shape again. So put that in your mind as we discuss other techniques and reasons why procedures fail and why people look unusual, etc. It all comes down to shape. The first concept between the different categories and types of facelifts is the depth. Now, facelifts, you should know, started around the early 1900s. And for nearly 70 plus years, all that was being done is make an incision, grab the skin, and pull it sideways towards the ear. What happened as a result of that, faces look pulled and stretched. scars became wider, ears became pixied. There are so many telltale signs that somebody has had a facelift that as a result, facelifts got an incredibly bad rap and were really not something that was a popular procedure for most people to do, because for the rational-minded person, why would they choose to look pulled and stretched and tight or windswept versus looking naturally aged? Even as a surgeon, I would take naturally aged over that appearance any day of the week. That went on for about 70 plus years, when somewhere around the mid to late 1970s, anatomists discovered that there is a layer called the SMAS. Now, the SMAS is just an acronym for basically the facial fascia. The facial fascia is what's actually involved and can be manipulated during a facelift procedure. So not just having to rely on skin, but having to be able to address the SMAS. Now, problem is, the traditional facelift being this very horizontal approach, skin only. Now the SMAS procedure comes into the picture, and the vectors that people were using to address the SMAS was still horizontal. In fact, when I was training 20 plus years ago, all of my professors and community mentors were doing a traditional SMAS technique, which was grab the SMAS and pull it away from the mouth. And as a result, I'm sitting here watching this as a young surgeon, and I'm seeing these mouths get completely pulled aside, and it just looked weird. So I knew for sure, from my point of view at that point as a young student, that this is not the right way to do it. In fact, there has to be a better way of restoring the face, really. So traditional and the SMAS techniques are mostly in the horizontal direction and continued to produce those type of results for a very long time, until the notion and concept of vertical orientation came into play. Now, there's a lot of different techniques that address the face in a vertical direction. The point here is that the vector is part of the equation when you're thinking about all of this. And I'm going to speak a little bit more about the vector when I speak about the vertical restore, which is the technique that I perform. But the bottom line is that the SMAS is a deeper procedure than the traditional skin-only facelift, but the vector is the same. So the ultimate results, not that different. Longer lasting, yes. Different, not really. Still looked unnatural, unfortunately. Then, right around the 1980s, a technique came around called the deep plane facelift. Now, the deep plane facelift didn't really change the vector too much, but it did something very important. It went deeper than the SMAS. And the depth here meant that we were separating the connecting tissue, which is the ligaments, of the cheeks, the jawline, and even the neck, in order to get a more free lift. Because instead of pulling like a rubber band across these fixed ligaments, which eventually pulled back, so durability was being affected, instead, by releasing these, you're able to get a more unopposed and longer lasting result. So the deep plane became this kind of niche procedure, more obscure, not really commonly done. Again, you got to remember, facelifts were not that common, 50 plus years ago. And as a result, it's kind of stayed in the practices of very, very few, but very good and very sought after facelift surgeons. The vertical restore, which is the technique that I'm going to describe to you here as my, sort of my baby, and the technique that I love so much because of the type of results that it gives. Think of it as taking the foundation of the deep plane and going further, not just further in terms of what it does in terms of release, etc., but the areas that it addresses. That is an incredibly important part of looking natural as a result of these procedures. Because remember, the most important outcome is that there is a youthful shape that is restored, but yet you look completely normal and natural. What you want is a combination of youthful look and undetectable outcome. Basically, no one can tell you've had anything done. And that's fundamentally my quest, and that has been fundamentally the reasons behind the evolution of the vertical restore. When I get asked about what makes the vertical restore different than the deep plane, it's almost everything, with the exception of the fact that the vertical restore does a deep plane dissection. Other than that, the incisions are different, the vector is different, the areas it addresses are different, and ultimately, as a result, the outcome is different. All right, so this brings us to zones. So what are the zones? So a lot of times in the history of plastic surgery and facial rejuvenation, surgeons have thought about the face in zones. They thought about the upper face, the mid face, the jawline, the neck. It never made sense to me. The face is aging simultaneously. The fascia, which, basically binds the whole face and is responsible for that shape, its upper attachment is at the temporal region. That fascia extends to the midface and this portion of the jawline, and it becomes the traditional SMAS. Then it extends down into the neck, same plane, same fascia, and it becomes part of the platysma, which is the neck muscle. So facial muscles, neck muscle, all of that is all connected. And then the downward attachment is your clavicle. So from the clavicle all the way up to your temporal region, all of this is technically one fascia, one unit, one zone. So the idea that people are getting brow lifts, mid-face lifts, lower face lifts, neck lifts never made sense to me at all, because all of these areas are fundamentally aging together. So why would you separate them when you know that the fascia is all technically one thing? So that's an important distinction between different types of lifts, because like I just mentioned a few of them, that's how people undergo procedure. They go see a doctor or surgeon and they say, hey, yeah, you need a mid-face lift, or you need a brow lift, or you need a lower face lift, which is basically tightening up your jawline, or you need a neck lift. To me, those are complete misdiagnosis and mistreatments of a bigger picture. And as a result of that, sort of paradigm and understanding, the vertical restore views all of this as one and addresses all of it simultaneously. All that fascia gets redirected back to where it came from, back to where it was when it was younger. And that's why the shape gets such a beautiful, youthful heart shape once again. So the next point of differentiation is the surgeon. The best theories in the world, the best ideas in the world ultimately come down to execution, right? So you could have great ideas, but if you don't execute them right, you don't have practice doing them, you don't have the skills to do them or the experience to do them, the outcome isn't going to be great. You can't underestimate the importance of choosing the right surgeon to get the right outcome. So this is something that I've always advocated for. You don't want to rush in to have any surgeon do your procedure. You also don't want to just simply accept any recommendation for that. You want to get pointed in the right direction, then do your own observational research, dig deep, try to understand, and hopefully this video will put into perspective some of the things that you should use to qualify the surgeons that you're evaluating. But ultimately, this is a very, very important part of the equation. And one of the reasons why this is so important is, in addition to all the things we just sort of alluded to, there's a concept of consistency that is so important. Almost every surgeon can create a beautiful home run looking result from time to time. Everything falls into place, things look great, etc. But the point is, can it be done consistently? Because inconsistent results means that for you who's having the procedure done at that very moment, if there's inconsistency, you don't quite know what you're going to get as a result of that. Bottom line is, this consistency is something you should definitely be looking for when it comes to surgeons. So you need to look at lots and lots and lots of before and afters and see how that plays out over time. Now, another question that comes up all the time is, well, why don't all these surgeons just start doing what you do? Well, number one, nothing that I do is a secret, okay? So let's be clear about this. I've even written a textbook on the subject. I've also speak at our national and international conferences, showing my techniques and how I perform it. And any good surgeon who understands facelifts knows exactly what I'm doing. The reason why people don't adapt or adopt new techniques is because they were trained differently. And if you are trained one way, it's very difficult mid-career to all of a sudden go in a different direction. And the reason is very simple. If you can think about it, there's a huge risk to getting it wrong on a patient during surgery, right? I mean, you get an unusual looking outcome, that patient is going to be very, very upset with you. And it's not often worth the stress, especially if facelifts are not necessarily the main part of your practice. Most surgeons do not have facelifts as their main part of their practice. They do a variety of different types of surgeries, and facelifts is just one of them. So if they're just doing it 2 or 3 times a month, and if they don't do the best possible facelift result, it's not gonna make or break their practice. Very different than a practice like mine, which all I do is vertical restores. I don't do any other types of plastic surgery. I have to get this right every single time. I have to earn the trust of every single person that comes through my door, decides that they're gonna have a consultation with me because of the outcome. So that is a huge, huge point, is training is different. And as a result, their day-to-day practices are going to be different. If there's a learning curve with every procedure, and that learning curve is not something that you as a patient want to be on the lower side of as they're learning a new technique. Does that make sense? Okay, quick summary just to put things in perspective. Results look unnatural and undercorrected when surgeons don't go deep enough and when they use the wrong vector. So when those two things are misaligned, no matter how good of a surgeon you are, your results aren't going to look completely natural and their results aren't going to be big. Now, if you add on top of that a surgeon that's not very experienced, now you can assume that even if you have the right technique and the right procedure, results may be inconsistent. So that's kind of the way to think about it. Because I know even for myself, my results have gone significantly more consistent over the years. Doesn't mean you as a patient should not go to a surgeon who's less experienced than somebody like myself, because if they're very talented, they're using the right techniques, and if you study their before and afters and you really like it, you should have trust and faith that they're going to do a great job. It's just that I'm giving you perspective on how to select and choose and what are the qualities you should be looking for. All right, so now I'm going to speak a little bit about what the vertical restore is. The direction of a face needs to go more or less upward, because if you ask somebody, show me what you want as a result of this surgery, they do this. They put their finger right on this bone here and in this part, and they lift up. It's this motion. This is an upward motion. Yet our facelifts were all, as I said, going side to side, which is not the right look. So I recognized that that was the vector that needed to be done, and I started looking for techniques that allowed me to go up in this direction. Now, I did that for about 10 years, and great results, super natural, got me so busy with facelifts and facial rejuvenation, but I realized I wanted the best outcome. I wanted, hands down, to be the best technique literally on the planet. And so I began to search for ways to make my previous technique better. And what I recognized was that I wanted to get a longer lasting result. I wanted a more powerful impact on the neck, and I also wanted a more powerful impact on the midface. So I began doing a deep plane. And I also realized that because I'm going vertical, pretty extreme vertical in this way, that I get this crazy bunching right around this area, and therefore I need to lift the upper third of the face at the same time. And as a result, I needed the vertical restore to basically be a procedure that included the lateral brow, midface, jawline, and neck, and to be in that deep plane to get a big freedom from the ligaments and also be able to redirect this in exactly the vector I wanted for each case, which is always customizable, and ultimately give a durable outcome. The average facelift, even a good solid SMAS facelift, is like 5 to 7 years, maybe on the top end 10. Deep planes have always been the longest lasting results. 10 to 15 years is probably what people should expect from them, of looking, really not perfectly youthful, because naturally you're going to age, but you're going to hold together pretty well. And then ultimately, at some point, you refresh it, but it gives you almost twice as long lasting results than a SMAS facelift for the most part. Again, properly executed, the right type of patient, etc., you're looking at almost twice as long as a typical facelift result. So those were all the things that led to development of the vertical restore. So why did I trademark this? Well, it's important because as a consumer, as a prospective patient, you need to know exactly what you're getting. My technique is different, and therefore I wanted my prospective patients to know that exactly what they're getting with me versus exactly what they're getting with another surgeon, so there's no confusion there. The technique is unique, therefore the terminology associated with it is also unique. There's also another category of aging changes that I think is super important and oftentimes not properly addressed during the rejuvenation process, and that is volume, right? So what do I mean by that? So as we age, there's a lengthening of fascia, which turns us from a heart to a rectangle. In addition, and partly contributing to that shape, is the loss of volume in very specific areas of the face. So where are those areas? Around the eyes and temples and around the mouth. Those areas begin to lose fat. And then when you go to restore the position of that soft tissue back to where they came from, those voids become even more noticeable. So using fat transfer in addition to repositioning the tissues back to where they were is a very important part of that natural look. And that's something that I have been doing literally with every single case. From the very, very beginning. I think it's been sort of the magic dust to why the results look so refreshed, so healthy, so natural, is the addition of that fat transfer. And it's extremely, extremely rare. Almost never happens that I do a vertical restore without a fat transfer simultaneously. It's almost automatic. Really what it comes down to is this. Patients who get the vertical restore get a powerful lift. What's crazy about it is how unbelievably natural and normal the face looks. This has been my hallmark. This has been my MO. This has been my claim to fame from day one, is how natural my outcomes look. And it's the most sought after quality of my vertical restore procedure is not looking like you've had anything done and looking normal, natural, like a younger version of you, which ultimately means you look as young as you feel. At this moment when I'm doing this video, I do about 6 of these cases a week. Up until last year, I was doing 8 of them. Comes out to 300 to 400 cases a year, which is massive amount of experience, means the results end up being consistent. So every single patient who gets the procedure comes out of this thing looking natural, huge improvement, no exception. Those are like my foundational guarantees that I can give somebody. I never tell somebody, oh, every little line's gonna go away, or there's not gonna be a slight bit of laxity here, or the creases around your mouth, or no, huge improvement, totally natural looking. And for anyone who's rationally minded and has the right expectations, that is a huge gift. And to know and have the peace of mind that that's what you're getting is a very confidence building, trust building, and a big reason why people literally travel from all over the country outside of the US for this procedure on literally a weekly basis. Another important topic that needs to be brought up when chatting with your prospective surgeons is the issue of complications. So every surgery, every procedure, every pill you take, everything has side effects and complications. There's no such thing as risk-free, but there is higher risk and lower risk. And the total concept as a surgeon needs to be risk mitigation, as well as increasing the benefit and decreasing the risk. So what are some of those risks? Well, obviously there's the risk of not looking good or botched. That's a terrible, outcome. And I think I've given you some ideas of how you can look for and evaluate a surgeon to avoid that from happening. But there's also intrinsic and inherent risks. There's hematoma, there's infection, durability. What are the things you should be looking for? So number one, let's just talk durability. Any surgeon who's doing a proper deep plane, who's properly trained and has the experience doing it, that result should last significantly longer than a facelift, as we talked about. Problem is, a lot of surgeons are using the term deep plane, and I hate to say this, I'm not throwing anyone under the bus. I'm just stating the mere fact that on a weekly basis, I do roughly 2 cases a week from patients who've had, quote unquote, a deep plane facelift 2 years ago. The reality is deep planes are hard to perform. They require a certain level of experience and technical understanding. A lot of surgeons are jumping on this bandwagon because surgeons like myself and other excellent surgeons are using deep plane as part of creating these outcomes, and every patient wants a deep plane facelift. So it's becoming increasingly in demand, but you don't have the supply for it. You don't have a lot of surgeons who really know how to perform it. And as a result, they do something calling it a deep plane, even though they're trying probably, but they don't have the experience releasing all the ligaments, doing all the kind of things, or the vector isn't the right vector, et cetera, all this stuff. And then ultimately the patient is left with a result that's like a year or 2 and they're now wanting to get it done again. Disappointment is a big deal. So make sure you know how many operations your surgeon is doing. Get a good head count on this, because you're not going to get a lot of patients if you don't do a great result. So that tells you something. If the surgeon's in demand and doing it on a regular basis, they're probably good enough to get the kind of results to earn that type of reputation and that type of demand. So that's a good sign. There's also some technical things, like for example, hematoma prevention. There's a number of things that we do to prevent hematomas, avoiding certain anticoagulants before surgery, ask for Motrin, herbs, etc., doing all those kind of really important preoperative measures ahead of time. In addition, postoperatively, what we do is we put compression sutures. We do these external sutures that run along the area where the skin has been separated from the deeper tissues, leave them in for 3 or 4 days, and it really decreases the risk of spontaneous hematoma, which is at the highest risk in that period of time. And then we take them out, and there's no harm, no foul, no marks, no nothing, and it's been a game changer, and I've been doing it for years now. Additionally, preoperative and perioperative antibiotics is really important to decrease the risk of infection, and ultimately just really close care from your surgeon's office that it helps you before surgery, but also helps you after surgery to really identify, treat early, etc., any things that might come up Because if you misdiagnose or mistreat a hematoma or a seroma or an infection, the results can be disastrous, and they can be a much bigger problem than if you arrive early and address those things and evaluate them. So this is where that relationship with the practice is so, so important. Careful, close post-operative monitoring. Another huge one is anesthesia. Now, you might not have a choice here because most surgeons perform general anesthesia. We perform all of our vertical restores with the exception of, very select, very rare cases, maybe 1 or 2 a year, where a person wants general anesthesia. Otherwise, we do them all under local with IV sedation. Doing it under local with IV sedation decreases the risk of adverse reactions to the anesthetic meds, decreases the risk of cardiac or pulmonary issues, embolism, pneumonia, all these things that could potentially leave you in a hospital after surgery. So it's a wonderful, beautiful thing that I can do this under local with IV sedation, effectively removing the risk of general anesthesia from the equation. I perform these procedures in about 2.5 to 3 hours, and that's about half the time that most surgeons take to do them. It's hard to put somebody under local with IV sedation for a 6-hour operation, which is the average time it takes to perform most of these. So this one you might not have a lot of sway with. I wouldn't say this is a reason to choose a doctor, but it's something to consider, especially if you have medical problems. You want to probably avoid general anesthesia or make sure you get proper clearance and good evaluation so that you can have a safe journey through the anesthetic. Put it all together, if you can decrease the risk of complications, you're going to heal faster, you're going to have less to deal with afterwards, etc. So this is a big deal and something that should be really focused and looked at when you're evaluating the process and the surgeons. We have a very, very low complication rate after surgery. Our reoperation rate is extremely, extremely low. I mean, we barely ever need or do revisions for anything. I mean, if there's something that needs to be done, we will. But 99% of the time, no one's getting a revision because they don't need it. And we avoid a lot of these complications. But if we do get into one, we'll address it and treat it and manage it very early, so it doesn't become a bigger problem later. Most of our patients take about 2 to 4 weeks to heal to a point where they're sort of restaurant ready or able to get back to work, etc. And remember, at the end of the day, you're doing this to feel better about your appearance, to feel more elevated emotionally, psychologically, and really look like you feel. And getting that outcome is extremely important to you. So take all of this very, very seriously, choose carefully, tread lightly, and be patient when you're selecting a surgeon. Most of our patients, and I'm not exaggerating, have been studying me and surgeons all over the country and world for 2 to 4 years before they finally make the decision. I mean, it's an incredible amount of research and care that goes into the decision making. But ultimately, by the time they get to me, there's full trust, there's full understanding of what I do, and it's a great journey from that point forward. All right, so let's take a moment and just kind of take a stroll down some of these before and afters. Things to keep in mind is, number one, all of these cases look totally like themselves, but the aging changes have been removed. If you cover the before photo and just look at the after photo, you'll never know that this person has had anything done. And there's a balance and harmony and overall youthfulness, and really pay attention to the shape restoration that has happened in these cases. I mean, that's really, at the end of the day, looking natural and shape, as I mentioned, is the two fundamental criteria to a successful outcome. And if you notice carefully, you'll also see that there's no change in the hairline, there's no change in the shape of the ears, the earlobes, the tragus. All of these things have remained exactly intact. Those are big tells of somebody who's had work done. And that took years and years of trial and error and, futzing around with little details to get this part looking really good. But at the base of it is because there's no tension on these areas. All the tension is being held on the deep plane and not on the skin. So there's no pulling these areas out of position. The scars are super fine, almost undetectable. The outcomes just look worthy of a ponytail and walking around and not even thinking about the fact that you've had anything done. All right, so let's talk about who's a candidate for a vertical restore. Basically, candidacy comes down to 3 criteria. Number 1, you have to have enough going on in your face to physically restore, right? So sometimes people jump the gun, they come in too early, they're being too hard on themselves. and I, lift their face and it's like, there's nothing there to lift. It's okay, come back in a few years or come back whenever, because this is not the time. So you have to have enough laxity to justify a procedure like this. But you don't have to look really old to do it. In fact, getting it done on the earlier part of the spectrum is probably better for you, because it means you are closer to what you used to look like. It's easier to get you back there. B, you don't have to live with it and be bothered by it for too long. But ultimately, it's a personal decision, which is criteria number 2. You have to feel like it's time, right? So you have to feel this is a good time for it. Like my wife knew totally clearly that this was the time that she wanted to get it done. It's worth the downtime. It's worth, the discomfort, the process, the risks. All of that is worth it to get the outcome that you're searching for. If those things are not worth it, that balance isn't there, then you're not ready yet. Okay. And all the risks, if you take it all together and say, okay, it's worth these risks to go into this procedure, because if I can get the outcome I'm looking for and manage through these risks, then it's good. But if you do it too early, those risks are going to feel an extreme burden, and going through recovery and everything else is going to be like, why did I do this? Why did I put myself through this? There's no point to it. I wouldn't even let you get there. I mean, this is part of our consultation process. Very carefully understanding your motivations, which brings us to the third criteria, your expectations. We never talk in the way of hey, I'm going to make you look like you're a 20-year-old. I never even say anything. I just say, look, significantly better than what you start with. Jawline, neck, shape, all that stuff. So if that level of correction is okay with you, and you're not being a perfectionist, and you're not being, I have to look this way or that way, just big time improvement and looking completely natural is your expectations, then you're going to be happy with the outcome. If not, you're going to feel very, very disappointed no matter how good your outcome is. And those are nightmare scenarios for surgeons, to be, deliver a great result and the person is not quite happy. And it happens to every surgeon. And we try so hard to avoid operating on those type of people. And that comes through conversations with our care coordinators, as well as consultation with me, is trying to identify good candidates from a expectation, emotional level, and moving up. Nowadays, we do see a lot of younger patients thinking that they need to jump ahead and do procedures like this, or because they're realizing that the non-surgical procedures don't quite give the results that they were, hoping it would receive, right? I mean, there's been kind of a decline in the expectations that come with like fillers and radiofrequency devices, et cetera. So they're thinking, okay, well, I got to get in and get a facelift done. And they're 30 something. That's not the right time for a lift, unless you're prematurely aging as a 30-something-year-old, which in that case, I'm happy to help you look like a 30-something-year-old. But trust me, you don't want to do it too early, because it's not worth all the things that we just talked about. But what you should be doing, and everyone who's considering facial rejuvenation should be doing, is taking incredible care of their skin from an anti-aging point of view. Because skin is aging just like the facial laxity is happening. It's happening independently. Skin's getting thinner, getting more discolored, fine lines and wrinkles, crepiness, pores, all these things are happening. So what you want to do is improve the quality of your skin over time. Trust me, if you have great skin and you get a well-done facelift, your results are going to look 10 times better than if you have rough-looking skin and you get a smooth contour to your face. It just doesn't quite look as powerful, as impactful. Sun protection is huge, and that should be a baseline. So that's one. The second aspect is powerful anti-aging skincare. Everyone, in my opinion, who's serious about skin anti-aging should be doing the Karam MD trifecta. It's super effective. Go check out the clinicals on it. In addition to being incredibly easy, so it's a no-brainer. Wash your face 2 steps and then off you go twice a day. And that will start to turn the currents away from what you're starting to see. Lines will become improved, discoloration will decrease, skin will look firmer, et cetera, et cetera. So if you want to learn more about this, go check out the Karam MD Skin website. All of these things have to be done on a consistent basis so that skin doesn't continue to age. You can manage that through skincare and sun protection. It's just really important. There's a lot of videos that I talk about the subject in detail. But if you're in your late 40s and early 50s and the laxity is starting to happen, or anytime beyond there, I mean, we treat patients of all ages, don't bother with more fillers, lasers, different types. It's not going to do anything. Trust me, save yourself the disappointment, the money, the time, the risk, all that kind of stuff. And if not, by all means, go give it a try and come back and let me know. But I'm sure you guys, many people who are watching this have experienced that. So drop some comments below. But if you're in your 50s and you're doing these procedures, it's just not going to be powerful enough to overcome the sagging and laxity. So if that's the case, then a facelift is your number one choice. This is your face you're talking about. It's important. And remember, my honest feeling is it's better to look older than to look weird or have a botched outcome and have to go through this again. So, and I mean this honestly, just like I said about the trifecta, for any of you who really value natural looking results as well as a powerful rejuvenation, the Vertical Restore, in my opinion, gives the best results, period, at least in my hands, right? So you combine surgeon, technique, experience, volume, all that stuff, and that's how it happens. But this video is not just a promotional video about how great Vertical Restore is. Even if every single one of you wanted to do it, I couldn't get to all of you in a lifetime. That's just the simple reality of it. But the bottom line is that all of this is useful for you to be able to choose carefully. Now, if you happen to end up becoming a patient of mine, I welcome you and look forward to meeting you one day. This is a video to explain to you that this is not a light matter. And there's a lot of differences out there. And that explains why you see so many really bad results and results that make you cringe and makes your spouses not want you to have the procedure done, et cetera, et cetera. So briefly, in summary, I hope you gained a little understanding about the psychological and emotional impact that facelifts can make if they're done well, if they meet expectations, some of the criteria for you to start looking and selecting your surgeons carefully, putting a little bit of context within that so that you become empowered and really, really well positioned to make great decisions for yourself. Be patient, be selective, and remember that the trust that you give a surgeon needs to be earned. And that's a very important quality and something that I personally am always humbled by, that people put that much trust in me, because you have to value the fact that the face is an incredibly personal and valuable thing, and it needs to be treated with skilled hands, and outcomes need to be as predictable as possible. And for me, Vertical Restore has been my tool to be able to deliver those type of results and help people consistently look as young as they feel. And if you want to learn more about these techniques, obviously check out my website, check out more videos, check out our Instagram, which shows tons and tons of before and afters. And if you haven't already, make sure you subscribe to this channel. If you enjoyed this video, make sure you liked it. And if you have any comments about this, questions about this, drop them in the comments below. And if you want to learn more about skincare and skin tips, the Karam MD Journal is a free newsletter that I write every single week and deliver to your email inbox, as well as check out our website, karammdskin.com, to learn more about the trifecta. All right, my friends, until next time, Dr. Amir Karam.